I want to talk to you today about something that's genuinely easy to mistake and that catches people out. A feeling of pressure, tightness, or fullness in the chest after eating, and how to think about whether it's indigestion, the more common cause, or sometimes the heart, since the two can feel remarkably similar, because chest discomfort after a meal is usually assumed to be indigestion, and often it is. Yet heart-related chest discomfort, angina, or even a heart attack can feel like indigestion and can sometimes be brought on after meals. So, understanding when after-meal chest discomfort might be the heart is genuinely important. So today I want to explain why chest pressure after eating can be either indigestion or the heart, why they're so easily confused, how to tell when it might be the heart, why it matters, and what to do, with the crucial emergency guidance in partnership with your doctor and emergency services. And I'll be clear and balanced, because while after-meal chest discomfort is often indigestion, it can sometimes be the heart, even a heart attack. And knowing when to treat it as a possible heart problem can save your life. In partnership with emergency services, this is about an easily confused symptom where caution genuinely matters. Let me start with why chest pressure after eating can be either, because understanding it frames everything. A feeling of pressure, tightness, or fullness in the chest after eating can come from either the digestive system or the heart, which is exactly why it's easily confused. On the digestive side, indigestion, acid reflux, and the simple fullness of a large meal commonly cause chest discomfort, burning, or pressure after eating, since the stomach and esophagus sit near the chest, and this is very common and usually benign. On the heart side, the heart can cause chest pressure or tightness, angina, or a heart attack, and, importantly, eating can sometimes bring on or worsen heart-related chest discomfort. After a large meal, blood is diverted to digestion, which can stress a heart with narrowed arteries, so some people get angina after meals. So chest pressure after eating can be digestive, the common cause, or sometimes the heart, since both can cause chest discomfort, and eating can affect both. So understanding that after-meal chest pressure can be digestive or cardiac is the foundation. So after-meal chest discomfort can be indigestion or the heart. So both digestion and the heart can cause it. Let me explain why they're so easily confused, because this is the crux. Indigestion and heart-related chest discomfort are easily confused because they can genuinely feel similar. Both can cause a pressure, tightness, fullness, or burning in the chest. Both can occur after meals, and both can come with some discomfort spreading to nearby areas. Heart-related discomfort, especially angina or an atypical heart attack, can feel just like indigestion, a pressure or tightness, sometimes with belching or a feeling of needing to burp, which is why people, including older adults and women whose heart symptoms can be atypical, sometimes mistake a heart attack for indigestion, with dangerous delay. So the crucial point is that you cannot reliably tell heart-related chest discomfort from indigestion by feel alone, which is exactly why caution matters with after-meal chest discomfort that has any concerning features. So, indigestion and heart-related chest discomfort are easily confused because they can feel genuinely similar and both occur after meals, so you can't reliably tell them apart by feel, which is why caution matters. So the two are genuinely hard to tell apart by feel, so you can't reliably distinguish them yourself. Let me help you recognize when after-meal chest discomfort might be the heart, because that's the practical heart of this. While you can't reliably tell yourself, some features make after-meal chest discomfort more concerning for the heart. Chest discomfort more likely to be the heart is brought on by exertion as well as meals, or coming on with exertion and eased by rest, like angina, accompanied by other heart symptoms, breathlessness, sweating, nausea, lightheadedness, or pain spreading to the arm, jaw, shoulder, or back. A pressure, tightness, or heaviness rather than a clear burning, occurring in someone with heart risk factors or known heart disease, or severe, new, or different from your usual indigestion. By contrast, Discomfort more likely indigestion is clearly related to particular foods, a burning sensation or reflux, especially worse lying down or bending, relieved by antacids, part of a long-standing indigestion pattern, and without heart symptoms. But crucially, since the two overlap and you can't be sure, any chest discomfort with concerning features warrants treating as possible heart. So after-meal chest discomfort with exertion, breathlessness, sweating, nausea, or arm or jaw pain, or that's severe, new, or different, suggests possible heart and warrants caution, while clear burning relieved by antacids in a long-standing pattern is more likely indigestion. So the accompanying features and pattern guide concern, but caution is key. So read after-meal chest discomfort by its features, cautiously. So concerning features flag possible heart involvement. Let me give the crucial emergency message, because this is where it matters most. Here's the crucial, potentially life-saving message. Treat chest discomfort as a possible heart attack and call emergency services immediately if you have chest pressure, tightness, or pain. After eating or otherwise, that is accompanied by breathlessness, sweating, nausea, lightheadedness, or pain spreading to the arm, jaw, shoulder, or back, is severe or different from your usual indigestion, comes on with exertion, or simply makes you suspect your heart or you feel very unwell. Don't assume severe or concerning chest discomfort is just indigestion and wait, or simply take antacids and delay, especially in an older adult or someone with heart risk factors, since heart attacks can feel like indigestion. When in doubt, treat concerning chest discomfort as a possible heart attack and seek emergency help, since being safe is far better. So treat chest discomfort with breathlessness, sweating, nausea, or arm or jaw pain, or that's severe or different, as a possible heart attack and call emergency services immediately, not assuming it's just indigestion. So act urgently on concerning chest discomfort. So concerning chest discomfort is an emergency. Let me explain why this matters so much. Because the confusion is dangerous. This matters because the very confusability of heart-related chest discomfort and indigestion is dangerous. People genuinely mistake heart attacks for indigestion, take an antacid, and wait while life-saving treatment is delayed, sometimes fatally. And, as I've discussed, in a heart attack, time is muscle and lives, so delay is catastrophic. So recognizing that after-meal chest discomfort can be the heart, that it can feel just like indigestion, and that concerning features warrant treating it as a possible heart attack, can prevent this deadly mistake. So this matters because heart-related chest discomfort is dangerously easy to mistake for indigestion, risking fatal delay, which recognizing the confusion and heeding concerning features prevents. So recognizing this confusion prevents dangerous dismissal of heart attacks. So it matters because the confusion can be fatal. Let me address the angina and after-meal pattern, because it's worth checking non-urgently too. Short of an emergency, if you notice chest discomfort that reliably comes on with exertion, or after meals in a way that seems linked to exertion or effort, and eases with rest, this pattern could be angina and warrants seeing your doctor for assessment, even if it's not an emergency at the time, since angina is important to diagnose and manage, and any new, worsening, or unrelieved exertional chest discomfort should be treated as a possible emergency. And if you have frequent or persistent after-meal chest discomfort you've assumed is indigestion, it's worth having it assessed to confirm the cause and rule out the heart, especially if you have heart risk factors. So a pattern of exertional or after-meal chest discomfort eased by rest warrants seeing your doctor for possible angina, and persistent assumed indigestion warrants assessment. So get an exertional or persistent after-meal chest discomfort pattern checked non-urgently too. So heed the angina pattern with your doctor. Let me be clear about what to do across situations, because the response should match the discomfort. So here's what to do. For chest discomfort with heart attack features, breathlessness, sweating, nausea, arm or jaw pain, or that's severe, new, or different, call emergency services immediately as a possible heart attack. For chest discomfort that reliably comes on with exertion or effort and eases with rest, see your doctor for possible angina, treating new or worsening exertional discomfort as a possible emergency. For frequent or persistent after-meal chest discomfort you've assumed is indigestion, especially with heart risk factors, see your doctor to confirm the cause. For clear, mild, long-standing indigestion relieved by antacids, manage it as indigestion with your doctor's help, but stay alert to any change. And when in doubt, err on caution. So call emergency services for concerning chest discomfort, see your doctor for exertional or persistent after-meal discomfort, manage clear indigestion accordingly, and err on caution when unsure. So match your response to the discomfort, erring on caution. So respond per the discomfort, cautiously. Let me paint you a quick picture of how this matters. Picture a man in his 70s who, after dinner, gets a pressure and tightness in his chest, with some breathlessness and a sweat, which he assumes is indigestion and treats with an antacid, lying down to wait. In the dangerous version, it's actually a heart attack feeling like indigestion, and his waiting costs him dearly. Now picture him understanding the confusion, knowing that heart-related chest discomfort can feel just like indigestion, and that chest pressure with breathlessness and sweating, even after eating, can be a heart attack, especially in an older man. He treats it as a possible heart attack and calls emergency services immediately. He gets rapid treatment, much of his heart muscle is saved, and he survives. The same man, but recognizing his after-meal chest discomfort with concerning features as a possible heart attack rather than assuming indigestion, got life-saving care. That contrast is exactly why understanding this easily confused symptom and erring on caution matters so much. Let me speak briefly to those of you caring for an older parent or partner. Understand that chest pressure or fullness after eating can be indigestion, the common cause, or sometimes the heart angina or a heart attack, and that the two can feel remarkably similar, so they're easily and dangerously confused. Crucially, if a loved one has chest discomfort with breathlessness, sweating, nausea, or pain in the arm, jaw, shoulder, or back, or that's severe, new, or different from their usual indigestion, treat it as a possible heart attack and call emergency services immediately, not assuming it's just indigestion, especially in an older adult or someone with heart risk factors. For chest discomfort that comes on with exertion and eases with rest, encourage seeing the doctor for possible angina, and manage clear, long-standing indigestion accordingly while staying alert to change. Helping a loved one recognize that after-meal chest discomfort can be the heart and err on caution can be genuinely life-saving. So let me draw this all together. A feeling of pressure, tightness, or fullness in the chest after eating can come from either indigestion, the common cause, or sometimes the heart, angina, or a heart attack, and the two are easily confused because they can feel genuinely similar and both occur after meals, so you can't reliably tell them apart by feel. After-meal chest discomfort is more concerning for the heart when it comes with exertion, breathlessness, sweating, nausea, or arm or jaw pain, or is severe, new, or different, while clear burning relieved by antacids in a long-standing pattern is more likely indigestion. But caution is key given the overlap. Crucially, chest discomfort with these concerning features must be treated as a possible heart attack with immediate emergency care, since heart attacks dangerously mimic indigestion. So call emergency services for concerning chest discomfort. See your doctor for exertional or persistent after-meal discomfort that could be angina. Manage clear indigestion accordingly while staying alert, and err on caution when unsure. So here's what I'll leave you with, straight and clear. First, understand that chest pressure, tightness, or fullness after eating can come from either indigestion, the common cause, or sometimes the heart, angina, or a heart attack, since both can cause chest discomfort and eating can affect both. Second, know that they're easily confused because heart-related discomfort can feel just like indigestion, so you can't reliably tell them apart by feel, which is exactly why caution matters. Third, Recognize the features that make after-meal chest discomfort more concerning for the heart. It comes on with exertion as well as meals, is accompanied by breathlessness, sweating, nausea, lightheadedness, or pain spreading to the arm, jaw, shoulder, or back, is a pressure or tightness rather than clear burning, occurs with heart risk factors, or is severe, new, or different, while clear burning relieved by antacids in a long-standing pattern is more likely indigestion. Fourth, and crucially, treat chest discomfort with these concerning features, or that's severe, new, different, or makes you suspect your heart as a possible heart attack and call emergency services immediately, not assuming it's just indigestion or simply taking antacids and waiting, especially in an older adult or someone with heart risk factors. And fifth, see your doctor for chest discomfort that reliably comes on with exertion and eases with rest, which could be angina, treating new or worsening exertional discomfort as a possible emergency. Have frequent or persistent assumed indigestion assessed, especially with heart risk factors. Manage clear long-standing indigestion accordingly while staying alert to change, and err on the side of caution when unsure. After-meal chest discomfort is often indigestion but can be the heart, and the two are dangerously easy to confuse. So recognizing this and erring on caution with concerning features can save your life, which is genuinely important. So take care of yourself. Recognize that after-meal chest discomfort can be the heart. Act urgently on concerning features, and see your doctor for exertional or persistent discomfort. And because heart-related chest discomfort can dangerously mimic indigestion, please treat chest discomfort with breathlessness, sweating, nausea, or arm or jaw pain, or that's severe, new, or different, as your reason to call emergency services immediately, rather than assuming it's just indigestion, and see your own physician for exertional or persistent after-meal chest discomfort.